Good afternoon, everybody. I'm Dr. Morrow. I'm here. I'm with American Mood Swings, and we're here with Dr. Keifer from Brain Health Hawaii in Honolulu, Hawaii, and Angela Keene, his medical marketing professional. And we are going to discuss electromagnetic stimulation. So thankful that you're here with us today. Thank you.
I really appreciate you having us. You're busy, we're all busy, but certainly anytime we can contribute to the conversation about, effective modalities or effective treatments for various conditions related to brain health, mental health, functioning and performance. Certainly want to set aside time and see how we can contribute and move the ball along and help people become aware of some of the things that that we're doing and that other persons are doing that can help many people.
All right. Well, yeah. Why don't we just jump right in and discuss what electromagnetic stimulation is, because most people haven't heard of it.
TMS, or transcranial magnetic stimulation, is a broad and growing field. Repetitive transcranial magnetic stimulation. Many people will automatically start to think about, one flew over the cuckoo's nest. That's electroconvulsive therapy. That's delivering sort of like an overwhelming amount of energy or current directly into the brain, so that it essentially leads to a massive convulsion seizure. Truthfully, I've seen that be successful for many people over my career. In fact, while I don't practice that, 10, 15 years ago, I would have referred folks that weren't doing so well in terms of depression and severe symptoms, and I've seen some ECT practitioners really do amazing work. So I certainly would not want to disparage, because I know that it's been around. It's very effective. It's just associated sometimes with some memory, mild memory and or mild cognitive effects. TMS is quite different. There's the conventional way TMS is done, which is more of a one-size-fits-all. That's FDA approved for depression, and then there's other RTMS approaches FDA approved for headache and OCD as well. That is very different. RTMS, or transcranial magnetic stimulation, is very different than ECT. It's a significantly reduced amount of energy that is basically a microcurrent or an electromagnetically induced current that will come out of usually a figure-8 paddle. Some manufacturers use other forms, a helmet, to stimulate a certain area of the brain right here, called the dorsolateral prefrontal cortex. What we specialize in is a personalized version of this, in that we are able to use a wireless EEG cap that measures brainwave activity. And in doing so, we're able to get a look at the neural connectivity or communication patterns in a given person's brain, and that tends to correlate with how they're feeling, whether they have mood symptoms, anxiety, difficulty concentrating, memory issues, fatigue. We see certain patterns in folks with long COVID brain changes. So utilizing this mapping technology, we're able to then use the existing repetitive transcranial magnetic stimulation machine in a hyper-personalized and more precise way. People here in Hawaii they describe it as like having just letting a chopstick bounce on the hand.
Okay.
You hardly feel it. We use it on use it on 4-year-olds, on up to 84-year-olds. People drive to and from, kids come before and after school, before and after their activities. And so essentially, one way to think about it would be ECT is like going to the brain electrical networks and hitting Control-Alt-Delete. Conventional RTMS would be like taking some people describe it as a woodpecker on the head,
Okay.
And then the way that we do it, I think probably the way to think about it is it's like using a tuning fork. There's almost just like a subtle vibration that people will feel, and it's basically about a 2 centimeter deep field that sort of gets right through the skull, gets right to the surface of the brain, and really gets the neurons in the brain to fire together. So that's what we see basically, is that most, if not all, of the neurocognitive, mood, executive functioning, anxiety symptoms correlate with disorganized, underactive, overactive neuronal activity in various parts of the brain. And so what we're essentially doing is using a gentle form of energy, much more gentle than the MRI that people use, to essentially wake up the neurons that are slow and slow down those that are going too fast, and to get everybody in harmony and visually connected in an organized manner. And in doing so, about 80-85% of the time we can get the clinical outcomes that we're used to seeing, and that people will regain a significant level of functioning, diminish symptoms, and kind of get on with their lives in a, I guess, relatively short amount of time. And it's non-invasive, doesn't involve any medication. I prescribe medication too in my clinic, so I'm not anti, but many people, that's a barrier for them, because they won't use medication, so it's just nice to be able to offer a gentle, non-invasive, non-pharmaceutical alternative for these various conditions that people struggle with.